We've had people literally at the end of their shift say, I'm done. I'm not coming back anymore.
Right now on ABC 10 News at 4 o'clock, one COVID surge after another pushes healthcare workers to the brink, leading to a staffing shortage at Scripps Health. How the organization is trying to overcome the challenges as the number of COVID patients increases. Plus, President Biden addresses the chaos in Afghanistan today, his commitment to help Americans and Afghan allies. And traffic restrictions along our borders are extended again, the major blow to South Bay businesses.
ABC 10 News at 4 starts now.
Scripps Health announced it's delaying some non-urgent procedures due to significant staffing shortages. This comes as COVID-19 cases continue to climb and hospital staff is overwhelmed. Thank you for joining us. I'm Kimberly Hunt. And ABC 10 News reporter Mimi Alcala spoke with the CEO of Scripps Health. Mimi is joining us live with why the hospital system will work differently now. Mimi?
Hi, Kimberly. He tells me the Scripps is taking this proactive approach and delaying some of those procedures that are not emergencies in an effort to help out the staff they do still have during this shortage.
There have been a lot of healthcare workers that have gone through 3 major surges already, and they're just tired.
Healthcare workers are dealing with yet another surge in COVID-19 cases and hospitalizations, causing burnout and fatigue for many.
We've had people literally at the end of their shift say, I'm done. I'm not coming back anymore.
Chris Van Gorder, president and CEO of Scripps Health, says the number of COVID-19 patients at Scripps 5 hospitals continues to grow since the state fully reopened.
We had 13 inpatients, 13 COVID inpatients on June 15th. That's when we ended the restrictions. And here we are today with 174 and growing.
In addition to the COVID-19 cases, they're also seeing more patients needing care that was delayed during the pandemic. And now the hospitals are dealing with significant staffing shortages. Right now, Scripps is looking to fill 1,309 full and part-time positions. That's compared to 832 open positions in August of 2019 before the pandemic started. When it comes to registered nurses, Scripps currently has 433 open positions compared to 220 in August of 2019. Van Gorder says they need employees to fill positions across the board.
We're talking about food service workers. We're talking about environmental services, surgical techs.
In an effort to continue providing the best care with short staffing, Van Gorder says Scripps has made the decision to delay some non-urgent procedures for patients. He says this will not look like it did last year when all elective procedures had to be canceled.
If it's not an emergency case, maybe a case can be delayed a few days or a week or even a couple of weeks. And it could be everything from, a heart case that is an emergency that could be delayed a little bit, all the way to other surgical cases or other kinds of procedures.
And Van Gorder says doctors will decide which cases can be delayed and for how long, and they'll notify their patients. We're live in Hillcrest. Mimi Alcala, ABC 10 News.
Thank you, Mimi. And the race to get vaccinated against COVID-19 is picking up speed. For the first time since early July, CDC data shows more than 1 million doses were administered in a single day. That's 73% higher than a month ago. Yet the number of COVID-related hospitalizations is on the rise, especially for young people.
These are healthy, young 20-year-olds, 30-year-olds who, because of the aggressive nature of the Delta variant, are now being hospitalized.
Multiple reports say the FDA could fully approve the Pfizer vaccine on Monday. It's unclear about a timeline for Moderna or the Johnson & Johnson versions. There's still a push to get authorization to vaccinate children under the age of 12. The fall semester at San Diego State officially starts today. Students are already on campus preparing for the first day of in-person instruction next week. ABC 10 News reporter Marie Cornell spoke to them about how the pandemic is impacting their back-to-school preparations.
The writing on the windows at the campus bookstore says it all. Welcome Aztecs, we're happy to see you. Little hints of a return to normalcy for San Diego State University as students prepare for the first day of in-person instruction. ABC 10 News caught up with senior Haley Stone, who describes what it's like being back on campus after spending the last year online.
It's definitely weird. I had to come the other day just to remind myself of where some of the buildings were for classes. And it was, it's funny just watching like freshmen and even some seniors just walking around campus trying to navigate their way again.
And there are some big changes for this fall. The university is requiring all of their students and staff to get vaccinated, or they'll have to get tested every week. Added precautions to try and prevent COVID-19 outbreaks on campus, which is what SDSU dealt with last fall, when there were more than 1,000 cases among students and staff in the first month of the semester. Freshman Ewan McIntyre says the university is taking things seriously. Even before he could move into the dorms from New Jersey, he had to submit a negative COVID-19 test.
I got one, uploaded it a few days before I moved in. Didn't go through though, so I get here and I had to take 2 more.
Extra steps these students say is worth it if it helps keep the school open.
If that's what has to happen for us to be back in person, then it is what it is. So I don't really mind.
And I have confirmed with university officials that they have hired extra teams to help patrol the areas around the university to check on any concerns regarding health and safety. Reporting from SDSU, Marie Cornell, ABC 10 News.
Monitor new developments in the pandemic in our ABC 10 News mobile app. It is free in the App Store.
But let me be clear. Any American who wants to come home, we will get you home.
Today, President Biden committed to help American and their Afghan partners get out of Afghanistan. This comes amid desperation at the airport in Kabul as thousands try to flee the country. The president also suggested the U.S. withdrawal deadline of August 31st could be adjusted. Camilla Bernal reports.
Chaos, confusion, and desperation. Americans and thousands of Afghans trying to leave the country, now controlled by the Taliban.
Imminent danger. They are moving from house to house, hiding from the Taliban.
Many not only struggling to get to the airport, but some U.S. flights out of Kabul also grounded for hours.
Incredibly hard time, incredibly hard time.
The U.S. government scrambling to address the crush of people looking to flee.
There's a lot of frightened people and frightened families, and there's a few casualties, and that's totally regrettable.
President Joe Biden admitting it will not be easy.
I cannot promise what the final outcome will be, or what it will be, that it will be without risk of loss.
But Biden committing to help Americans and Afghan allies.
We're going to do everything that we can to provide safe evacuation for our Afghan allies. But let me be clear. Any American who wants to come home, we will get you home.
I'm Camila Bernal reporting.
Insurance regulators will be looking into the use of zip codes and credit scores in determining car insurance rates. Insurance companies are defending their formulas and say they never discriminate based on race, but research by insurance advocates has found the pricing system taking zip codes and credit scores into account can discriminate. The National Association of Insurance Commissioners, which oversees the industry, voted this week to study the underlying causes of racial discrimination in the industry. This comes more than a year after the association's Special Committee on Race and Insurance launched.
Here we are, a year after they finally acknowledged a problem that we've all known about for a long time. And all they've done is come up with some agreed upon discussion points.
Doug Heller is an insurance expert with the nonprofit advocacy group Consumer Federation of America. He says some commissioners have been taking their own action on this. Washington State banned the use of credit pricing in the car insurance industry temporarily under an emergency order earlier this year. California, Hawaii, and Massachusetts have had these bans in place for years.
So the system right now is set up to be unfair. And the best we can do as consumers is kind of try to shop our way around some of that unfairness and then demand reform from the policymakers.
He says anyone who shops around for car insurance will likely save some money. That's because insurance companies have their formulas for determining rates set up differently. Some new, smaller insurance companies also say they're looking to focus more on driving habits to determine rates rather than personal characteristics. Now, the National Association of Mutual Insurance Companies tells us that eliminating data points from consideration will force insurers to assume that all drivers represent the same level of risk. It will make riskier drivers harder to identify and will increase rates for everyone.